Moving up in bed when your resident is unable to help. Helping your resident move and be comfortably positioned is one of the most important things you will do as a nurse assistant. Remember that the Centers for Medicare and Medicaid guidelines say that all long-term care facilities must ensure that residents' abilities for the activities of daily living do not diminish unless their health deteriorates. A primary activity of daily living is moving about freely. Statistics indicate that the leading cause of injury to nurse assistants involves incorrect body mechanics when moving and lifting. These injuries often occur because of poor planning when moving or positioning your resident. For your safety and your residents', before you try to move or position any resident, decide whether you need help. You may need help for many reasons. If you are unsure how your resident will respond to your help, if you do not know your resident well, or if you're uncomfortable lifting your resident by yourself, be safe and get help. Always get help if you are unsure at all.
Hi, Caroline.
Hi, Helen.
How are you doing today?
I'm doing pretty good.
That's good. Do you have a few minutes?
Yeah.
I have Mr. Smith in 103 and I need to reposition him. Do you think you could give me a hand?
Oh, sure.
Remember all the steps to be aware that you learned in the opening video as you prepare to move the resident or assist them with positioning.
Good morning, Mr. Smith. It's Ellen and Carolyn here to help you move up in bed. Can we come in?
Yes, you may.
If your resident is supine and needs help moving up, down, or to the side of the bed for personal care or repositioning, remember to first position the bed for the move. Put the head of the bed flat if your resident can tolerate it, and move the pillows against the headboard.
That's great.
Good.
Communicating with residents and your coworker is important. Serious injury can occur if someone does not understand how the move is to be done. Be sure to talk clearly with your resident about their role. For residents who are able to, have them bend their knees. This will help with the move.
Great, thanks.
Roll the draw sheet up from the side toward your resident until you and your helper both have a tight grip on it with both hands. Keep your palms up if that gives you more strength for moving. You can put one knee on the bed to get as close to your resident as possible. If needed, place a barrier on the bed to protect your uniform. If your resident is able, ask him to lift his head off the bed during the move.
1, 2, 3.
Use good body mechanics during the move. Then, unroll the draw sheet and tuck it in on both sides. Be sure to eliminate wrinkles in the sheet, and make sure your resident is in proper body alignment. Before leaving your resident's room, make sure you understand your resident's needs and review the ending steps that you learned in the introduction video. This helps to ensure that you make the accommodations needed to complete every procedure.